Сайн байцгаана уу хүн үзэгчдээ. Өнөөдөр орой манай дефактоны нэвтрүүлгийн зочноор олон улсын шарын холбоо гэж олон төрлийн бус байгууллага байдаг. Тэрний ерөнхийлөгч ноён Чарльз Гор оролцож байна. Good evening, sir.
Good evening.
What is that about the World Hepatitis Alliance that where you are president is? What is that?
It is an umbrella organisation. It's a non-governmental organisation, and it's composed of members who are patient groups, and we have now about 210 in 80 countries. And we started it in 2007 because I could not believe how little attention viral hepatitis had in terms of global health. In terms of infectious diseases, all the emphasis was on HIV or tuberculosis or malaria. And we now know that viral hepatitis, and principally hepatitis B and C, kill more people than HIV or malaria or TB. At the time, I have to say in 2007, I didn't know that, but I did know that it was tremendously neglected. And so I had been operating a patient group in the UK, and so I was in touch with a lot of patient groups from around the world, and I asked them to send a representative for their geographic region to a meeting we held, and I said to them, would you like to do something about this? And out of that came this idea of having a World Hepatitis Day, and the Alliance was set up to run that initially. And then, of course, things happened, and we couldn't get governments to engage with the day because they said it's not an official day. And so in order to make it an official day, we had to get a resolution through the World Health Organization. And then, as a result of that, we became much more involved in advocacy generally and trying to get countries to do something about viral
Because
hepatitis.
many governments are member of this WHO.
194.
194, you see. What is the very day? Which day is that
That's
Hepatitis
interesting
Day?
because we started it, when we did it as a community initiative, we had it in the middle of May, which is actually a nice month. It's generally a pretty good time. When the governments made it an official day, they moved it, and it's now July 28th.
July 28th, which...
And can be in the middle of summer, it can be very hot in some countries. In fact, when we were trying to get this adopted, the French said, oh no, we're going to oppose this resolution. We cannot possibly do that. We're all on the beach. There's no way that we can...
In Australia, the people are on the ski resort.
Exactly.
Well, can I call you Charles, right?
Please.
Charles, this disease, which had impacted many people's life during the whole that time that the human can know the disease, that disease had impacted you personally 20 years ago. And being a citizen of England, living in London, how could ever it happen?
People contract viral, I mean, the thing about viral hepatitis B and C is that it's much more common than people realize. 400 million people are living with it, and it's really in every country. No country is spared from this. But most people don't know they're infected because for many years people don't feel ill often. And so that's what actually happened to me. I didn't feel particularly ill, and I became jaundiced. And it was a result of that I got diagnosed with hepatitis C. And actually then it turned out I had cirrhosis, and then I did actually get very ill for a while.
Based on our understanding that Mongolia is one of the most affected countries, as you know, today. This hepatitis C, B, whatever, comes to liver cirrhosis one day. And some people, lucky people, sometimes learn that they have this disease. In fact, early in their life that they can treat. Some not, like my own father, who discovered later on. It was already too late, and he passed away 51 years old, which was so tragedy in my life, in our family. So how to to make sure that first people discovered if they have disease early?
Well, that's exactly one of the reasons that we set up World Hepatitis Day. And when we wanted to make it an official day, the countries did listen to us, and they did take our point that awareness, and particularly the prevention of liver cancer or liver cirrhosis, was critical. And the only way to do that was to get people tested. For that, you need to raise awareness. But still, globally, we're not doing a very good job. There's still, the majority of people are not diagnosed. So we still, and this is not just Mongolia, you know, it's the same in the UK. Less than half the people with either hepatitis B or C are diagnosed. The death rate is still going up year on year. And we need to make more effort. And one of the things that I get cross about is the 194 countries of the world said, yes, we resolved to make July 28th World Hepatitis Day because we realized we've got to raise awareness. But then still many countries do very little, or some of them nothing, actually on July 28th to raise awareness with their people, to get their people to come forward for testing.
And at this your visit, Mongolia is going to make a historic step in this regard. I understand we have some privilege of having relatively very cheap the pills, whatever it is, to treat that sickness, this disease. What is that pills about?
Well, this is what is the very good news, but also, again, something that makes me very cross. We have the solutions for both hepatitis B and C. In hepatitis B, we have this fantastically cheap vaccine, and actually Mongolia has done a really good job in introducing that. But we also have treatment that will stop people getting liver cancer or cirrhosis. And just recently, the price of one of the key drugs for hepatitis B, although it doesn't cure you, it suppresses the virus and stops people getting these liver complications, has fallen very dramatically. It's still not cheap enough and needs to become cheaper. In hepatitis C, we've really just recently had this breakthrough with these new drugs that are extraordinarily effective. But in the developed world, they're very expensive. In my country and in America, they're at least $50,000 for a cure. And what is great is that Mongolia has agreed on a pricing that is much, much more realistic and much more affordable.
Some few $100s.
Yes. Something like $1,200 for a cure.
That's how many months of course is this?
3.
So for 3 months, a month about $400 and 3 times. And Mongolia is going to, they agreed to buy at that level, and they will still give with the same price, at the same price to our Mongolian people who had effects. That's fantastic news, isn't it?
It's fantastic news. And not only that, the Ministry of Health, with a lot of help from NGOs like the Onon Foundation and the Hepatology Society, are just in the final stages of developing a comprehensive plan that will be ready, I guess, in the next month or two, so that Mongolia can really address this with ambition and determination, and make sure, first of all, that you prevent new cases, that the people who are already infected are diagnosed, and then to this affordable treatment, and they can be cured, for hepatitis C at least.
Okay, Charles, let's talk separately. We talk about hepatitis B, hepatitis C. And many people, as intelligent as myself, also diligent, we don't know exactly what is the difference. Please tell us what is that differences and what is the way of affecting your health.
One of the worst things that happened is that when they decided to name these diseases, the first virus that they found that affects the liver, so hepatitis just means it causes inflammation of the liver. They called virus A, and then the next one B, and then the next one C. And it sounds like actually they're all the same disease but slightly different. In fact, the viruses are completely different, completely separate. They just cause the same problem, which is liver disease. Yeah. So hepatitis B is a virus that is endemic in most of Asia. And a lot of the time it's transmitted from mother to baby at birth. Although you can contract it through blood, you can contract it sexually. Hepatitis C, as I say, is a very different virus. And it's not really transmissible sexually, but you get it through infected blood. It's much less likely to get it from your mother, for example. But unsafe healthcare is a very good way of passing it on, and that's where the majority of infections came from. But the point is, they both do the same thing, and that's, they both end up with liver cancer or liver cirrhosis.
So you can treat, first of all, you can treat both. Second, you can also prevent both. And what is the more common in Mongolia out of this B and C?
It appears that they're almost exactly the same number of people. About 200,000 people have B and about 200,000 have C.
My goodness, each 10% or less than 8% or so of the country, 16% altogether.
Yeah, but in fact, that's only of the adult population, so maybe even a bit higher than that. So, yeah, it's a very worrying, and then you have a very unfortunate added complication in Mongolia that is probably unique in the world, which is that you have a huge infection with hepatitis D, or Delta. And this is a virus, again, completely separate from the others, does the same thing, but is very aggressive, and so causes cirrhosis and liver cancer in a shorter period. But the thing is, you can only get it if you already have hepatitis B. It requires the hepatitis B virus to go on replicating.
Sort of, these people have more prone to D.
Yes. Then in
my goodness.
Maybe something like
Any
three-quarters
on
of,
D?
yeah, maybe something like three-quarters of the people who have B may have D as well.
Okay.
So there have been some different studies with slightly different rates.
So what do they do, our government in Mongolia, about this D? So you go, to treat D, you should treat B, or together.
Well, it's a little more complicated than that, because whereas with C, you can cure it, with B, the moment really in almost all cases, you can only suppress it. And that means that the D can still survive. And there isn't really any very good treatment for D. There is a treatment, but it's not terribly effective. So the best thing really is, first of all, prevent B. So if people don't get B, they won't get D. For the people already infected, you need to treat the B anyway. And then what we're really doing is waiting for new treatments for D to come along.
Let's talk in two ways. One, if you find out that somebody close to you in your family has one of these viruses. Obviously, it's a member of your family you cannot avoid. What is the minimum things you have to do?
Are you talking about to avoid transmission?
A member of other, yes.
Yeah, okay.
So.
The thing about these viruses is that they're not very infectious. They're very infectious if you come into contact with somebody else's blood and that blood gets into your bloodstream. And when you think about it, there are some ways that can happen, but not in casual contact, kissing someone or shaking their hand or any of those kind of things. So it's really about trying not to, if you cut yourself, being very careful that you clean it up, but not perhaps to go overboard with it too much.
Toothpaste.
Yeah, I mean, be careful with toothbrushes, have your own one, but it still would be very difficult. I'm not aware of any case that has been proved that that was the route of transmission. But you might want to be careful with things like tattooing. I don't know how popular tattooing is in Mongolia.
Tattooing, well, getting popular, unfortunately.
Yeah, that's the thing. And if the tattoo parlor is not licensed and doesn't have proper hygiene, then that's an issue.
So then the government must regulate these people who makes tattoo.
That would be a very good thing. And also make sure that within the healthcare system, that is safe, that there is proper infection control.
Charles, our recent history is full of unfortunate situations where a family, a member of your family or somebody's family get so much affected by this disease that they had, in some cases, in lucky cases even, they need to replace liver. It has a hell of expensive surgery. They go to Korea mostly. I think only last week we made in Mongolia. But before to Korea, 50,000 or even more, 100,000 US dollar surgery, etc. And then they get somebody finds all this blood similar to or adjustment, etc. Very complicated situation. They finally find one. I mean, in which case they need to go through that replacement? Which B or C, or how come?
Unfortunately, it's both. It's because they both attack the liver. The liver gets damaged to such an extent that it stops working properly, and you get many complications. And there comes a point at which it's working so little that you absolutely need to get a transplant, get a new liver. And
how common is that transplant in the world?
The only reason it's not a lot more common is that there are not enough donor organs. So, for example, we calculated in the UK that if we cured everyone with hepatitis C, it would make no difference to the number of people having a transplant, because the demand is you'd stop transplanting people with hepatitis C, but you'd transplant people for other liver diseases, because there is a huge demand for livers. Because viral hepatitis is not the only cause of liver disease. Alcohol is a major issue. And so increasingly in many parts of the world is obesity and fatty liver.
You mean alcohol obsessive consumption, or what do you mean?
Well, yes, absolutely. So people who are drinking really large amounts. But if they have viral hepatitis as well, even quite small amounts can increase the damage quite a lot. So if you have viral hepatitis, it really is best not to drink. And I know that in some parts of the world, and maybe you can tell me if this is true in Mongolia, there is quite a history of alcohol consumption in quite large amounts, and it's to do very often with socializing with...
Mongolia is not, surely not the least consuming nation, of course.
Well, with a very heavy burden of viral hepatitis, that can be a problem, having a lot of alcohol and viral hepatitis.
Charles, let's talk a little bit on another subject. You were a banker, not doctor, and happened to have this disease 20 years ago. You have completely cured, right? All this, with the help of the proper treatment in your country. And it was covered by insurance, right? Insurance.
It was free. I mean, we have a...
What do you mean?
Well, we have a slightly curious system in the UK where our health system is entirely free, and it's paid for, rather than by insurance, it's paid for by taxes. Just the general taxation pays for our healthcare system, so anyone can go and get treatment.
How long, what kind of treatment you have gone through then?
I went through, before these new drugs appeared, there was an older treatment, which is still being used in some parts of the world, which is really a drug called Interferon, which boosts your own immune system to fight the virus. And it can be very successful, but it's quite unpleasant because, for example, if you have flu, why you feel ill with flu is your immune system fighting it rather than... And so similarly with this, when you have a boosted immune system, you can feel pretty awful. And it can be anywhere from 6 months to a year, and some people have had to do 18 months of treatment. I was doing a year's worth of treatment, and it was difficult. But I was actually particularly unlucky. The interferon can have these side effects. Some people really don't have them, but some people have them just while they're on treatment. And some people have longer lasting side effects. And in my particular case, and this is very rare, but it does happen, but I think only with people with cirrhosis, the immune system is boosted so much that it starts attacking one's own body. And in my particular case, my immune system attacked my pancreas, destroyed enough of it that I'm now dependent on insulin. I'm a diabetic, in fact, now, as a result of the treatment. But I got cured of my hepatitis C. So I think it was a fair swap.
Well, and both are treatable anyway. All right. How often do you drink?
I don't. So what happened, when I discovered that I had cirrhosis, before I did treatment, I stopped drinking. So that was nearly 20 years ago. Because I decided it was really...
Well, you know, why I'm asking, in our world, say, if I can say, in the banking world, investment banking, you were investment banking with Bank of America, right? No weekends, you know, pubs, the story, you know, how much people drink. And I'm surprised, really, how much UK guys drink beer, but still very well filling. In general, the observation, I don't know that big things inside, but that was my feeling. So that's why I was asking the question.
Yes, we have a bit of a problem with alcohol in the UK, and the thing is that the liver is a great organ. It really doesn't complain for a long while, and it doesn't complain even while you're damaging it a lot. And the thing is, actually, if you go out and test people, you find they have liver damage. So they may think they're fine, actually they're not, and they really need to do something about it.
What's the test about?
Well, there are all sorts of tests. You can do a blood test that shows whether you have elevated enzymes. So that's something that, if your liver is damaged, leak more into your bloodstream. So the higher they are in your bloodstream tells you how much damage is going on. Enzymes. And there is another way of assessing the damage to your liver through, you can have biopsies, or you can have something called elastography, which fires a sound wave through it, and that will tell you. And it is amazing. You go out and test people at random, because we do this sometimes for viral hepatitis, but we find actually it turns out they don't have viral hepatitis, but it's clearly that they're drinking too much, and they're really shocked that they have damage that they have no idea about.
Without any hepatitis B, C, or whatever, but still the liver is damaged because you drink too much.
Yeah.
Wow. So that means prevention could be way cheaper than the treatment afterwards.
Prevention is always cheaper. It's just trying to get people to do prevention. The other thing is that sometimes prevention doesn't seem like such an attractive option for governments. To give you an example of Egypt, because obviously one of the things that I do is I visit lots of countries, and in Egypt they have had quite a big treatment program for hepatitis C, but they were doing nothing to prevent it. So they were treating somewhere around 70,000 people every year and curing about half of them with the old treatments. But they had at least 150,000 new infections every year because they weren't doing anything about it. Well, that's just nonsense.
How about this dynamic in Mongolia? Do we get every year more people with that infections or not?
There are some ongoing infections. I think, I'd hope that this is under control, but it definitely more work needs to be done. It always does.
I'm wondering about these two statistics, having 200 people with each viruses, in total 400, and those that have already in statistics. But we are not sure how many people have this disease, and yet they don't know they have this disease.
Well, of the 400,000 is an estimate, and it's based on where you go out and, for example, test 1,000 people, and so you get an estimate of the numbers. So that's not 400,000 people who've been diagnosed. That's supposedly the total. But my understanding is I think less than half have been diagnosed.
So even so, because we need to have a proper checking of this population. At the end, it's only 3 million, probably a half of Cairo, you see, in Egypt. And what is the best way to have that sort of prevention measure in a country, nationwide?
Okay, well, I mean, in terms of prevention, you've got to make the healthcare safe. That's really the key way of doing this. Then you need to make sure that people who are infected know that they're infected, so that they do something about making sure they don't transmit it to other people. And for that, in a country where you have such high rates, really, you need to test all adults. And I think that something that it's part of the, I hope it's going to be part of the national plan. Certainly it's something that Onam Foundation have been really pushing for. Test everyone, all adults, for hepatitis B and C. And then it becomes a question of what is the most practical way of doing that? Could you do that at family doctors? So you ask every time someone goes to...
We have this family doctor system. Every family is supposed to have a registration with local family small hospital.
Then that might be the system you would use. And my understanding is that you have a pretty good healthcare system in Mongolia.
It could be better.
It could always be better. But in terms, in the sense of being very well organized. And that therefore perhaps gives you the infrastructure.
You have the sense somehow that there's some...
Yes, that the infrastructure is there. And therefore this idea that perhaps you could eliminate both hepatitis B and C in Mongolia in a reasonable time period is actually doable. And that's why I'm here. Because I am really excited about the idea that Mongolia could be an example country. That when I'm going around talking to other ministries, I could go, you know what? This is what they're doing in Mongolia, and these are the results. Why are you not doing it in your country?
Even though Mongolia is doing that. Charles, you know, based on what we have talked and what I'm learning these days, what the government, this Onam Foundation is going to do, I'm so excited. So I'm so happy that you agreed to come to this program to share the thoughts, because I hope it will help many children having their parents' life. That's why.
Well, thank you. I'm delighted to be here, and I was extremely sorry to hear about your father. But this is the truth in Mongolia. This is not a unique thing. There is much too much death from viral hepatitis, and it can be stopped. And I'm here to support what is going on here. And as I say, I hope be able to showcase what Mongolia is doing. And it would be nice to see Mongolia as really a leader in this.
Let's make it.
Indeed.
Thank you, sir.
Thank you very much.
Хүндэтгэгчтэй манай өнөөдөр де-факто нэвтрүүлгийн зочноор олон улсын энэ шар өвчний холбоо гэж байдаг. Тэрний олон нийтийн байгууллага юм байна. Төрийн бус. Энэ байгууллагын дарга ерөнхийлөгч ноён Чарльз Гор их баярлалаа. Дан